Early signs and symptoms of heart attack you should never ignore. Irregular heartbeat. Sometimes your heart might beat fast, flutter, or skip a beat, especially when stressed or excited. This is usually normal. But if you're getting palpitations or a heartbeat that won't slow down, along with chest pain, pressure, dizziness, or trouble breathing, then it's a good idea to see a doctor. Pain that spreads to the arm. Another common sign of a heart attack is pain that spreads down your left side. Usually, it starts in your chest and moves to your arm. But some patients where just arm pain turned out to be a heart attack too. Nausea, indigestion, heartburn, or stomach pain. Some people, especially women, might feel more like they have a bad case of indigestion, nausea, vomiting, and stomach ache. Now, an upset stomach can happen for all sorts of reasons, like something you ate. But it's important to know it can also be a sign of a heart attack. You feel dizzy or lightheaded. If you feel shaky or lightheaded sometimes, maybe you skipped a meal, forgot your water bottle, or just jumped up too quickly. That's usually nothing to worry about. But listen up. If you feel dizzy and have chest pain or trouble breathing, see a doctor right away. Throat or jaw pain. A sore throat or jaw on its own isn't usually a heart problem. It's more likely a muscle strain, a cold, or sinuses acting up. But if you get tightness or pressure in the middle of your chest that travels up to your throat or jaw, that could be a heart attack warning sign. You get exhausted easily. If you suddenly feel super tired or out of breath doing stuff you used to breeze through, like stairs or groceries, see your doctor. We care more about these big changes than everyday aches and pains. Especially for women, feeling wiped out for days with no explanation could be a sign of heart trouble. Snoring. You know that little rumble in your nose when you're sleeping? That's snoring, and it's normal. But if your snores get super loud and sound like you're choking, that could be a sign of sleep apnea. You stop breathing for short bits of time while you're snoozing, and that's not good for your heart. Sweating. If you suddenly get all sweaty for no reason, it could be a sign of a heart attack. Not trying to scare you, but if that happens along with any of these other symptoms, let the ambulance take you. Don't even think about driving yourself. A cough that won't quit. A long cough with white or pink mucus isn't usually heart trouble. But if you already have heart problems, or think you might be at risk, it's worth getting checked out. Because when your heart struggles to keep up, blood can leak back into your lungs. This can irritate them and make them cough up white or pink mucus. Your legs, feet, and ankles are swollen. Feeling bloated can happen for many reasons, but it could also be a sign that your heart isn't working quite as well as it should. When this happens, blood can flow back up in your veins instead of circulating properly. This backup can cause bloating in your belly. A struggling heart can make it harder for your kidneys to do their job of getting rid of extra fluids, which can also lead to that uncomfortable puffy feeling. So that's all for today's video. If you like it, click the like and bell buttons. We'll have another video for you soon. Take care until then.